molecule called homocysteine that acts like sandpaper on the inside walls of your arteries, raising stroke risk by significant multiples. Today, I am revealing which two medications are dangerous to combine with B12 after age 60 and exactly how to protect yourself. Drop a comment and tell me where you're watching from and type your age in the comments right now because what I am about to share is especially critical the older you are. This channel is dedicated to bringing you the latest evidence-based research on senior health in a way that is actually practical and easy to use. If you have not subscribed yet, I would encourage you to do that now so you never miss what we are covering. Let me tell you about a patient I will call Herbert. Herbert was 69 years old, retired engineer. He had been taking a high-dose B12 supplement every morning for 3 years on the advice of a well-meaning family member who had read about B12 deficiency in seniors. He was also on two medications that his cardiologist had prescribed. His doctor had never asked about his supplements. Herbert had never thought to mention them. He came to me after a routine blood panel showed elevated homocysteine levels. He had no symptoms. He felt completely fine, but his homocysteine was nearly 3 times the upper limit of normal. And his arterial health, assessed through a carotid intima media thickness measurement, showed accelerated thickening, consistent with someone significantly older than 69. The combination responsible for this was sitting in his medicine cabinet and on his kitchen counter. Both completely legal, both widely used, both trusted by millions of seniors. Together, in his specific case, quietly damaging his arteries. We will come back to Herbert because correcting this changed his homocysteine levels within 12 weeks. Before I name the two medications, you need to understand homocysteine because this is the molecule at the center of everything I am about to tell you. Homocysteine is an amino acid produced naturally in the body as a byproduct of protein metabolism. In small amounts, it is normal and harmless. In elevated amounts, it is one of the most well-documented independent risk factors for cardiovascular disease, stroke, and dementia in older adults. Here is what elevated homocysteine does. It damages the endothelial cells, the delicate inner lining of your arteries. Research published in the New England Journal of Medicine linked elevated homocysteine to a 3-fold increase in heart attack risk and a 2-fold increase in stroke risk in adults over 60, independent of cholesterol, blood pressure, or other standard risk factors. Normally, the body keeps homocysteine levels under control through a process called methylation, which converts homocysteine into harmless compounds. This process requires 3 specific B vitamins as cofactors: B12, B6, and folate. When these vitamins are adequate and balanced, homocysteine is cleared efficiently. But here is where the danger begins for seniors on specific medications. Vitamin B12 supplementation, particularly in the high doses found in most over-the-counter supplements, which are typically 500 to 2,000 micrograms, far beyond the recommended daily intake of 2.4 micrograms, can actually disrupt this methylation balance. When combined with medications that interfere with folate metabolism or B6 pathways, when folate or B6 is simultaneously compromised, B12 supplementation pushes the methylation cycle in an unbalanced direction. Homocysteine accumulates instead of being cleared, and the arterial damage follows. Medication number 1, metformin. Metformin is the most widely prescribed medication for type 2 diabetes in the world. Hundreds of millions of people take it, and it is effective. I am not questioning its value in diabetes management, but metformin has a well-documented and often under-discussed effect on vitamin B12 absorption. Research published in the British Medical Journal found that long-term metformin use reduced serum B12 levels in 30% of patients taking it through a mechanism involving the disruption of calcium-dependent membrane receptors in the ileum that are required for B12 absorption. Here is the dangerous interaction. A senior on metformin already has compromised B12 absorption. They then take a high-dose supplement. That supplement B12 is not adequately absorbed, but simultaneously disrupts folate balance through competitive absorption mechanisms. Homocysteine clearing is impaired from both directions. B12 tissue levels remain low. Folate balance is disrupted. Homocysteine rises. A study in diabetes care found that metformin users who supplemented B12 without medical monitoring showed higher homocysteine levels than non supplement users, precisely because of this imbalanced methylation pattern. If you are on metformin, your B12 supplementation needs to be medically monitored with regular serum B12 and homocysteine testing. Do not self supplement with high doses. Ask your doctor for appropriate dose based on your actual serum levels. If you have made it this far, you are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Over the years in my clinic, I have seen one simple truth. Real progress does not come from doing anything extreme. It comes from doing the right small things consistently every single day. That is exactly why I created the 30-day blood pressure reset for seniors. It is a simple, step-by-step plan designed to help support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can easily follow at home. Some of my patients, and even people who have already gotten the guide, have followed this exact structure and started seeing real noticeable improvements. You will actually see some of their feedback on your screen because I want you to hear it directly from them. Many of them have shared that they feel more in control of their daily habits, more confident about their blood pressure readings, and more at peace knowing they are finally doing the right things for their health. For many of them, it was not about drastic changes. It was about having a clear, simple plan they could actually stick to, and that is what made the difference. I am not opening this to everyone. I am only allowing 30 people to go through it right now because I want to follow up closely and see how each person is doing. If you feel like your current routine is not giving you the clarity or results you need, click the link in the description or scan the QR code on your screen to get your copy before all the spots are filled. And because you are part of this community, I have made it easier for you with a 70% discount. After you get your copy, drop your email, and I will personally follow up with you checking in and helping you stay consistent with the plan. Now, here is exactly how to protect yourself. How to protect yourself, the 3-step protocol. Step 1, get your homocysteine tested. This is a standard blood test that most doctors do not routinely order. Ask for it specifically. A healthy homocysteine level is below 10 micromoles per liter. Above 15 is considered high risk for cardiovascular events. Knowing your number gives you and your doctor the information needed to make the right decisions about supplementation. Step 2, if you are on metformin or any PPI medication, do not self-supplement B12 at high doses. Instead, ask your doctor to test your actual serum B12 level and prescribe an appropriate dose based on the result. The supplementation dose that is safe and effective varies significantly based on your absorption, capacity which your medication is affecting. A blanket 1,000 microgram supplement from a store shelf is not personalized medicine. Your B12 status after metformin or PPI use requires personalized supplementation. Step 3. If supplementation is needed, ensure B12 is taken alongside B6 and folate in a balanced B-complex formulation rather than as isolated high-dose B12. The methylation pathway requires all three working together. An isolated high B12 dose without adequate B6 and folate support disrupts the balance that keeps homocysteine in a safe range. Research from the HOPE 2 trial confirmed that combined B12, B6, and folate supplementation reduced homocysteine levels significantly more than B12 alone, with corresponding improvements in vascular outcome markers. I promised I would come back to Herbert. We stopped his self-prescribed high-dose B12 supplement. We tested his actual serum B12, his B6, his folate, and his homocysteine. We prescribed a balanced B complex at doses appropriate to his measured deficiencies rather than a high-dose single supplement. And we worked with his cardiologist to review whether his PPI was still clinically necessary. At 12 weeks, his homocysteine had dropped from nearly 3 times the upper limit to just above normal. At 6 months, it was within the healthy range. His carotid intima media thickness at his 12-month scan showed no further progression of thickening. He said, I was taking that supplement to protect my heart. Nobody told me it needed to be done properly. That is the message of this entire video. B12 supplementation can be genuinely protective after 65, but it needs to be done with knowledge of what else is in your system. The supplement is not the danger. The uninformed combination is. Let me close clearly. If you are over 65 and taking vitamin B12 alongside metformin for diabetes or any proton pump inhibitor for acid reflux, you need to have your homocysteine level tested and your B12 supplementation reviewed by your doctor. Do not stop your medications. Do not stop B12 without guidance. Simply have the conversation and request the test. The three-step protocol: test homocysteine, personalize your B12 dose based on actual serum levels, and supplement with a balanced B complex rather than isolated high-dose B12. Which medication are you currently taking? Tell me in the comments. And if someone you care about is over 65 and self-supplementing B12 alongside either of these medications, share this video with them today. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously, but that moment usually never comes. That is exactly why I put together the 30-day blood pressure reset for seniors. It is designed to help you follow a simple, structured daily routine that supports healthy blood pressure without confusion or stress. Inside, you will find gentle exercises, practical daily habits, and a clear to. Some of my patients, and even people who have already gotten the guide, have followed this exact structure and started seeing real noticeable improvements. You will see some of their feedback on your screen because I want you to hear it directly from them. Many of them have shared that they feel more in control of their habits, more confident about their readings, and more at peace, knowing they are finally doing the right things for their health. For many of them, it was not about drastic changes. It was about having a clear and simple plan they could follow. Disclaimer: everything shared in this video is general medical and educational information based on current published research in cardiovascular medicine, pharmacology, and nutritional science. It is not personal medical advice for your individual situation. Do not stop or change any prescribed medication based on this video. If you are concerned about interactions between your medications and supplements, please speak with your doctor or pharmacist. They know your full medication profile and can advise you appropriately.